I'm Madeleine Casey, the owner and founder of Sparkle Lifestyle and MediSpa, and I want to talk about skin resurfacing. What is skin resurfacing? What's that problem? What does it even mean? So skin resurfacing would be more treatment that will help resurface your skin. So if you have issues like maybe scarring, or bumpiness or textures, or just wrinkles, deeper wrinkle or a smaller wrinkle, or it would be like a texture problem in your skin. So it's fixing that texture, whatever the problem is. And we have different options for skin resurfacing. I will discuss first Oxygeneo. Oxygeneo is a facial. The first step of that facial is actually a really deep exfoliation. So what that means, we will be removing all the dead skin cells of your face, and that by itself will really improve your texture. So if you have those light bump on your skin that's associated to dryness, or maybe just dead skin cell around, I strongly suggest to get Oxygeneo. You should get that facial almost every season change. That's how I get mine done, and it just maintain your good results. So that facial would give you a little bit of a skin resurfacing. If you, let's say you have it's just smaller bump, or you're like the late 30s, or you're starting noticing that you don't have those deep wrinkle yet, you don't have like big bump, but you just want to kind of even things out before you get too late, I strongly suggest a treatment, a laser resurfacing. The one that we're using here at Sparkle is called Resolve. Resolve will create little cavitation under your skin, and your own plasma will go and fill those cavitation, and it will really do a good job on any just smooth your skin out. If you have like small, maybe scarring, little, you used to have acne, that would really help. Or fine line, you don't have deep line yet, but you just want that smoother look. Resolve is amazing. It's a procedure that we say there's no downtime attached to it, but yes, you'll be red for probably a day or two. It's a little bit more, I don't want to say invasive, but it's not as enjoyable, let's say, an Oxygeneo, but it's not something that will take you days to recover from it. You come here after work and you'll be able to go back to work the next day. It's just you'll have to apply some mineral makeup on top of it, because you might be a little bit red and swollen, but it's a treatment that's amazing. I usually recommend to people to have it every year, twice a year if they want, but or they could be like in an initial cure of 3 treatments, and you're just gonna maintain your results every year after that. It's really nice, and we can even add like a last pass on top of it that would take care of any kind of pigment that you have at the same time. So that's a really nice facial that you would get. The third skin resurfacing that we have here at Sparkle, it's a CO2. CO2 is a little bit more invasive, where you would require a week off from your work. You need to see the doctor first. So the doctor will assess you, making sure that that everything is good to go for you. And the treatment, we freeze you first, and I don't want to say it's comfortable. It's not that bad because you're frozen. You might be swollen a little bit, but the results are really nice. I would use that treatment for someone that have acne scar, heavy acne scar, or a deeper wrinkle, or maybe if you're like past your 50s and you didn't really take too much care of yourself, you don't want to go for a facelift, you want something that will really improve the texture, the elasticity, and the pigment on your skin. That's really a nice option. We usually do 1 or 2 treatments, and then every 4 months. We don't go faster, but it gives really nice results, especially if you feel like you're starting to be wrinkly in your neck area. CO2 work really well. We love using CO2 on stretch mark on your body, stretch mark or scars. It works really well. So as you see, there's many different options that you could do for skin resurfacing, but they all really works and they can be combined all together. I strongly suggest a consultation because it's really not one size fit all type of approach when you do skin resurfacing. You might need like one Oxygenio, then a Resolve, or like a series. I strongly suggest to get a consultation with us so you can really see what's the best option for you. I hope this understanding a little bit what skin resurfacing is, and feel free to let us know if you have any questions. Bye bye.